For the past 30 years, Matthew Donnelly had conducted research on the use of X-rays. The exposure to the radioactive waves took its toll, and he was diagnosed with skin cancer. Eventually, he lost his nose, left hand, 2 fingers on his right hand, part of his jaw, and his vision. Doctors estimated that he had under a year to live. Due to the excruciating pain, he pleaded to be put out of his misery. However, his pleas went unanswered. Matthew's brother, Theriault, unable to ignore Matthew's repeated cries, walked to the hospital and shot and killed his brother.
With medical technology today, we are able to keep chronically ill patients alive well past what was previously possible. However, the newfound treatments are oftentimes painful and uncomfortable for the patients. Family members witnessing their loved ones in pain has sparked the debate over physician-assisted death and its legality in America.
Physician-assisted death refers to the practice in which a physician provides a competent patient with a prescription for a lethal dose of medication, upon the patient's request, which the patient intends to use to end his or her own life. This should not be confused with euthanasia, which is the killing of another in order to relieve dire suffering, and is illegal in all states.
Since 1994, PAD has been legally conducted in 5 different states. Oregon, Washington, and Vermont all have legal programs in place that allow patients to seek out PAD. Montana and most recently New Mexico have established courts ruling that support PAD.
I personally believe with physician-assisted dying that people do have the right to decide if they want to die, if they want to or not, by whatever means. I mean, Texas is no stranger to lethal injection when people, when it's their punishment, when it's capital punishment. So if people are going to be forced to die in one way because they did something wrong, if they have their own choice to die, then that's their choice, and if everything's going to be covered, then I feel like it's right. They should allow it.
I think the legalization of PAD would decrease the value of human life, and I think it would go against the doctor's Hippocratic oath.
I believe that physician-assisted death should be allowed because the patients die knowing that it was their choice. Vital organs can be saved and used for other people's transplants that need these organs.
I think doctors should not engage in assisted suicide because they're an image of trust to the public, and I feel like that trust could be broken once they start assisting other people and helping them end their life. Many religions believe that if you commit suicide, you're sent straight to hell, so it could be harder for the families to hear that.
There's a lot of pain reduced on the patient's family, because when you see someone you love and care about suffer, you will suffer with them.
I'm against physician-assisted suicide personally because I believe that you should just let nature take its course, and you shouldn't exert that type of control with, science and medicine. When it's your time to leave, then you'll know when.
Okay, so I think this should not be legalized because it could open the door to non-critical patients to commit suicide. It should not be legalized because it decreases the value of human life.
When a person's physical life dies, that's not the end of them. And so in a sense that can be very comforting, particularly for somebody who is in pain and suffering and nearing the end of their physical existence. Don't know what the future holds, but if there eventually is a legalization of a physician's right to, under appropriate conditions, to terminate somebody's physical existence, there may be situations in which that is the desirable outcome for the patient and for the family of the patient.